there's a nationwide shortage of midwives, many women are being told that they may not achieve a home birth, which causes a great deal of anxiety for them. Victoria visits her midwife, Mitch Denny, at her local clinic.
I'm sure that'll be in the bin soon.
Victoria's blood pressure is normal. Mitch then checks the growth of the baby by measuring from the pubic bone to the top of the bump. This should relate in centimetres to the gestation of pregnancy.
Actually 37 centimetres.
So it has got big.
So it's so average, so good. And I'm just going to put that. Would you like to listen to the baby?
Yeah, go on, we'll do that instead.
She checks on the baby's position, which is head down, and its heartbeat, which is normal.
Sounds good.
When she was pregnant with Theo, the growth of the baby was less than it should be, and Victoria was worried that it might be the same this time, because if it was smaller than it should be, her midwife might recommend a hospital birth. But there are no worries this time.
But no one's going to say now it's too. You know,
That's never going to come up now.
It would be so unlikely because you're measuring all the right size. It feels a good size baby.
Victoria doesn't like the idea of a plastic cord clamp and discusses with Mitch the possible alternatives.
What I need to ask you, what with the county and NHS other ways can I do the cord other than that plastic clip? I don't want to use that. And a friend of mine said I can use Benson as well. Like a sterilised piece of string.
Yeah.
And you can get that. And a friend who's a midwife at Worthing said you just get it, boil it, and put it in something that's been boiled as well, so it's all sterile. And then you just tie it really tight, and it does the same thing. I just really don't like those plastic clips.
I'm thinking.
So if you were there, if it's you, and then I said, oh, this is how I'd like to do that.
Yeah, we're not going to worry.
But would you do it then?
Yeah.
Right. Okay.
We've always used plastic clamps for a very long time.
Yeah.
I did work at a hospital when I was student nurse. I have to admit this is quite a long time ago. And I worked there in the mothers in Hackney, and they didn't have plastic things. They did it with elastic band.
Right. Okay.
But that was very primitive. But that's what they decided, and then they changed. If you wanted to, we could put the plastic clip not near your baby. Okay, first cut the cord shorter, and then we've got time, half an hour afterwards, to just do that taping of the cord. Yeah.
So that doesn't have to be done immediately.
We clamp here with with the plastic clip, not near your baby like that.
Yeah.
We put the clamp, and we cut it, and then the cord is quite long.
Yeah.
Until we've just got time for you to have skin-to-skin contact, and then we tie that string and make it nearer. Sometimes the cord isn't very long, so when you're delivering your baby and holding the baby, sometimes you haven't got a lot of long length cord. So once the cord is on, we cut and clamp it. So I would suggest, and you don't have to do this, is that we kept the cord long and just put the plastic on, and then you can hold your baby and it's still it's got the plastic, but you can have a skin to skin contact, and then we do it afterwards, so it's not fiddling them out with the string when someone's not used to doing that.
So Victoria and Mac's baby is growing well, and they're still on course for their home birth.
It's a Wednesday. It's the evening. I can't remember when I last did my diary. I'm currently painting my toenails to make myself look pretty for giving birth. It's quite tricky to actually be able to bend over the big fat belly and paint my toenails. But just because you're pregnant, I don't think you should start not taking care of your toenails and fingernails. Saw the midwife today, that all went very well. It was really nice to chat to her, asking her about different ways to tie the baby's cord, and what people would be happy doing on the NHS and stuff if they're not used to doing different sort of things other than that horrible plastic clip, which I really don't want to use because it endlessly gets covered in poo and it's a bit tricky, and I'd quite like Theo to be involved in helping me change the baby's nappy and stuff like that. And I think for an 18-month-old, how irresistible is a big white piece of plastic that he'll just have to have a little poke at, or a little twist, or a little tug. So we've decided to use embroidery thread, which I think sounds quite nice. Like plait it in nice little rainbow colours and stuff. I was always thinking this baby would be born on either the 28th, 29th, which is this Monday or Tuesday, but starting to think maybe that's not the case, but maybe from Monday I just won't do anything. It's Tuesday the 29th, the baby hasn't come. I thought it was going to come either yesterday or today, so I was wrong. Mac reckons it's going to come on the 4th of September. That just seems like ages away till it comes, and I'm struggling to think of what to do with Theo now for the rest of the summer holidays. Friends lent me some little pink bits, so even if it's a girl now it has something to wear. Not that girls can't wear blue, but some little frilly bits. The little risque halter neck. Baby's moved into a really bizarre position. It was always head down and back this side and all the little legs here, and then the other day it seems to have gone over here. All these legs, I don't know if that's a sign that it's gone really low down and it's getting ready, or if it's a sign that it's gone down and now it's got wedged into a really bad position.
It's 6:30 in the morning and Victoria's labour has started. They've called for the midwife, but the news isn't good.
Get all the stuff out here.
There's no one currently available to assist in a home birth.
Cupboard.
I think it's the remedy she's on about. I think it's the remedies.
Have you called her mum?
Yeah, she's called about 6 o'clock this morning.
So what did the midwives tell you?
Well, for some strange reason, they didn't want to speak to me. So what I say isn't good enough. So they'd only speak to Victoria. So I'm unsure as to exactly what they said, but Vic just threw the phone down and said the labour ward's closed.
Mac's plan of making a quick exit is not to be, as Victoria needs him with her, at least until her mum arrives. Theo's gone to a friend's house. Victoria takes a homeopathic remedy to help with the pain of the contractions, and then tells us how the conversation with the hospital went.
I don't even know if that's the right one to take. She said, I can't do that right now. I said, oh, do you know that we're down, did Max say we're down for a home birth? And she said, no, he didn't. I can't do that right now. And I said, what do you mean? I'm not having it right now. Oh, I'm stuck in a stupid position. It is, honestly, it's going to fall out. It's going to fall out. I don't